Question 1. A nurse is reviewing the medication administration record for a client diagnosed with hypertension. Which of the following medications is primarily used to treat high blood pressure? A. Furosemide. B. Lisinopril. C. Metformin. D. Atorvastatin. Answer B. Lisinopril. This question tests knowledge of common antihypertensive medications. The keyword hypertension directly indicates the condition being treated. Lisinopril is an ACE inhibitor, a class of drugs widely prescribed to lower blood pressure by relaxing blood vessels. Furosemide is a diuretic, metformin is for diabetes, and atorvastatin is a statin for cholesterol, none of which are the primary treatment for hypertension. For instance, when a patient's blood pressure is high, a doctor will likely prescribe a medication like lisinopril to help manage it. A good tip is to remember that medications ending in pril are often ACE inhibitors used for blood pressure. Question 2. When assessing a client's skin, the nurse notes a reddened area over the sacrum that does not blanch when pressure is applied. This finding is indicative of which stage of pressure injury? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Answer A. Stage 1. The question focuses on the staging of pressure injuries, with the key clues being reddened area and does not blanch. Non-blanchable erythema, meaning the redness doesn't fade when pressed, is the defining characteristic of a stage 1 pressure injury. This indicates the first signs of tissue damage, even though the skin is still intact. For example, if you press on a red spot and it stays red, it's an early warning sign. Remember that stage 1 is about intact skin with non-blanchable redness. Question 3. A nurse is caring for a client who has just undergone a total hip arthroplasty. Which of the following actions should the nurse implement to prevent dislocation of the new hip prosthesis? A. Encourage the client to cross their legs when sitting. B. Advise the client to avoid bending the hip more than 90 degrees. C. Position the client with their legs internally rotated. D. Assist the client in performing deep knee bends. Answer B. Advise the client to avoid bending the hip more than 90 degrees. This question relates to postoperative care following a total hip arthroplasty, specifically preventing dislocation. The key is to maintain proper hip alignment to keep the ball of the artificial hip in its socket. Bending the hip past 90 degrees, crossing the legs, and internal rotation are movements that can increase the risk of dislocation. Therefore, limiting hip flexion to less than 90 degrees is a crucial preventative measure. Think of it like this: you need to keep the hip in a safe, open position to avoid popping it out. A good reminder is to avoid those deep bends that could stress the new joint. Question 4. The nurse is preparing to administer an intramuscular injection. Which of the following sites is generally considered the safest for an adult client due to the absence of major nerves and blood vessels? A. Deltoid muscle. B. Dorsogluteal muscle. C. Ventrogluteal muscle. D. Vastus lateralis muscle. Answer C. Ventrogluteal muscle. This question tests knowledge of injection sites and safety. The keyword safest and the consideration of nerves and blood vessels are crucial clues. The ventrogluteal site, located on the hip, is preferred for intramuscular injections because it has a thick muscle mass and is far from major nerves like the sciatic nerve, and avoids large blood vessels. While deltoid, dorsogluteal, and vastus lateralis are also IM sites, the ventrogluteal is often considered the safest and most reliable for many medications in adults. Here's a tip: When in doubt about IM sites, think of the ventrogluteal as the gold standard for safety due to its anatomical advantages. Question 5. A client is admitted with symptoms of a stroke. The nurse should prioritize which of the following assessments? A. Auscultating lung sounds for crackles. B. Checking for peripheral edema. C. Assessing for unilateral facial drooping. D. Measuring abdominal girth. Answer: C. Assessing for unilateral facial drooping. The question centers on the immediate assessment priorities for a client suspected of having a stroke. The crucial keywords are stroke and prioritize. Stroke is a neurological emergency, and assessing for neurological deficits is paramount. Unilateral facial drooping is a classic sign of a stroke, indicating neurological impairment. While lung sounds, edema, and abdominal girth are important assessments in general nursing care, they are not the immediate priority when a stroke is suspected. Think of it this way: seeing one side of the face droop is a big red flag for brain issues. Always remember that stroke assessment starts with the FAST acronym, which includes checking the face for drooping. Question 6. A nurse is teaching a client about managing type 2 diabetes. Which of the following statements made by the client indicates an understanding of the teaching? A. I should eat a diet high in simple carbohydrates. B. I need to monitor my blood glucose levels regularly. C. Exercise is not recommended as it can lower my blood sugar too much. D. I only need to take my medication when I feel sick. Answer: B. I need to monitor my blood glucose levels regularly. This question assesses the client's understanding of diabetes management. The core concept here is the importance of consistent blood glucose monitoring. The keyword understanding prompts the identification of correct self-care practices. Regular blood glucose monitoring allows the client and healthcare team to track how diet, exercise, and medication affect blood sugar levels, which is essential for managing type 2 diabetes. The other options describe incorrect or harmful practices for diabetes management. For example, testing your blood sugar helps you know if your food choices are working. A helpful reminder: consistent monitoring is key to keeping your diabetes in check. Question 7. A nurse is providing care for a client with a new colostomy. Which of the following is the most important nursing intervention to promote effective stoma function? A. Irrigating the colostomy daily. B. Ensuring a secure seal of the ostomy appliance. C. Applying a paste around the stoma to absorb moisture. D. Massaging the abdomen to stimulate bowel activity. Answer: B. Ensuring a secure seal of the ostomy appliance. The question focuses on the care of a client with a colostomy and seeks the most important intervention for effective stoma function. The key terms are colostomy and most important nursing intervention. A secure seal of the ostomy appliance is critical to prevent leakage of stool, which can lead to skin irritation and breakdown around the stoma, as well as odor and discomfort. While other options might be part of colostomy care, a proper seal is the most immediate and essential factor for its function and the client's comfort and safety. Think of the ostomy bag like a diaper. It needs a good seal to prevent leaks. A good tip to remember is that the appliance's seal is the first line of defense against leakage. Question 8. A nurse is caring for a client experiencing shortness of breath. The nurse observes that the client's lips appear bluish. This finding is known as A. Cyanosis. B. Jaundice. C. Pallor. D. Erythema. Answer: A. Cyanosis. This question tests the recognition of a specific clinical sign. The keywords are shortness of breath and bluish lips. Bluish discoloration of the lips or nail beds is a sign of insufficient oxygen in the blood, a condition called cyanosis. Jaundice is yellowing of the skin, pallor is paleness, and erythema is redness. Observing bluish lips is a critical indicator that the client may not be getting enough oxygen. For instance, if someone is having trouble breathing, their lips might turn a bit blue. Remember that blue lips usually mean not enough oxygen is getting around. Question 9. The nurse is assessing a client's pain level using a numerical rating scale from 0 to 10. The client states, "My pain is an 8. This indicates A. Mild pain. B. Moderate pain. C. Severe pain. D. No pain. Answer, C. Severe pain. The question is about interpreting a pain score on a numerical scale. The client's statement, "My pain is an 8, is the key piece of information. On a 0 to 10 scale, scores typically ranging from 7 to 10 are considered severe pain, indicating a significant level of discomfort that requires prompt intervention. Mild pain is usually rated 1 to 3, and moderate pain 4 to 6. Therefore, an 8 signifies a high level of pain. Think of it like a grade. 8 out of 10 is a pretty bad score. A simple way to remember this is that numbers in the higher range of the scale mean more intense pain. Question 10. A client is prescribed warfarin. The nurse understands that which of the following laboratory tests is used to monitor the therapeutic effect of this medication? A. Complete blood count, CBC. B. Prothrombin time, PT, and international normalized ratio, INR. C. Blood urea nitrogen, BUN, and creatinine. D. Potassium level. Answer, B. Prothrombin time, PT, and international normalized ratio, INR. This question tests knowledge of anticoagulant therapy and its monitoring. The keyword warfarin is the critical clue, as it's an anticoagulant. Warfarin works by interfering with vitamin K metabolism, which affects blood clotting. The PT and INR are laboratory tests that measure how long it takes for blood to clot, and they are specifically used to monitor the effectiveness and adjust the dosage of warfarin to achieve a therapeutic anticoagulated state. CBC monitors blood cells, BUN/creatinine assess kidney function, and potassium is an electrolyte, none of which directly monitor warfarin's clotting effect. For example, doctors regularly check your INR to make sure your blood is thin enough but not too thin. Remember that warfarin plus INR are like a matched pair for monitoring blood thinning. Question 11. A nurse is preparing to administer an intravenous fluid bolus to a client who is hypotensive. Which of the following fluid types is typically the first choice for rapid volume expansion? A. 5% dextrose in water, D5W. B. 0.45% sodium chloride, 1/2NS. C. Lactated Ringer's solution. D. 5% dextrose in 0.225% sodium chloride, D5W/1/4NS. Answer, C. Lactated Ringer's solution. The question is about managing hypotension with intravenous fluids, with hypotensive and rapid volume expansion being key indicators. Lactated Ringer's solution is an isotonic crystalloid that closely resembles the electrolyte composition of plasma, making it an excellent choice for rapid intravenous fluid replacement to increase circulating volume and blood pressure. D5W is hypotonic once dextrose is metabolized, 0.45% NS is hypotonic, and D5W/1/4NS is also hypotonic, all of which can shift fluid into cells rather than expanding intravascular volume effectively. For instance, if someone's blood pressure drops suddenly, giving them lactated ringers can quickly boost their fluid volume. A good way to think about it is that isotonic fluids like lactated ringers are like adding more volume to the pipes to raise the pressure. Question 12. A client has a dressing change for a surgical wound. The nurse notes that the wound edges are well approximated and there is minimal redness and swelling. This is an indication of A. Infection, B. Dehiscence, C. Evisceration, D. Healing by primary intention. Answer, D. Healing by primary intention. This question tests the understanding of wound healing processes. The keywords well approximated, minimal redness, and minimal swelling describe a healthy wound environment. Healing by primary intention occurs when wound edges are surgically closed and heal neatly with minimal tissue loss. Infection, dehiscence, wound separation, and evisceration, protrusion of organs, are all signs of impaired healing. For example, a clean surgical cut that is stitched up neatly and heals without problems is healing by primary intention. Remember that primary intention means the wound is closing neatly and cleanly. Question 13. A nurse is assessing a client receiving a blood transfusion. The nurse should monitor for which of the following signs or symptoms of a hemolytic transfusion reaction. A. Urticaria and pruritus. B. Fever and chills. C. Wheezing and bronchospasm. D. Bradycardia and hypotension. Answer, B. Fever and chills. The question focuses on recognizing a severe adverse reaction to a blood transfusion. The key terms are blood transfusion and hemolytic transfusion reaction. A hemolytic reaction occurs when the recipient's immune system attacks the transfused red blood cells. Common signs and symptoms include fever, chills, back pain, and dark urine, indicating the breakdown of red blood cells. Urticaria/pruritus suggest an allergic reaction, wheezing suggests a respiratory reaction, and bradycardia/hypotension can occur in various reactions, but fever and chills are particularly indicative of a hemolytic response. For example, if a patient starts shivering and feeling hot soon after starting a blood transfusion, it's a serious warning sign. A good tip is to think of a fever and chills as the body's way of reacting to something foreign like incompatible blood. Question 14. A client is diagnosed with a deep vein thrombosis, DVT. The nurse understands that the primary goal of treatment for DVT is to A. Dissolve the existing clot. B. Prevent the clot from increasing in size. C. Prevent the clot from dislodging and traveling to the lungs. D. Increase circulation to the affected limb. Answer, C. Prevent the clot from dislodging and traveling to the lungs. This question assesses understanding of the primary treatment goal for deep vein thrombosis, DVT. The critical keywords are deep vein thrombosis and primary goal. While preventing the clot from increasing, option B, and dissolving it, option A, are related effects of medication, the most immediate and life-threatening concern with a DVT is the risk of pulmonary embolism, PE, which occurs when a piece of the clot breaks off and travels to the lungs. Therefore, preventing dislodgement is the paramount objective. Increasing circulation, option D, is not the primary goal and can even be harmful if it dislodges the clot. For instance, the biggest danger of a DVT is that it can break off and go to your lungs. So, the main aim of treatment is to stop that from happening. A helpful takeaway: think of DVT treatment as trying to keep the clot in place so it doesn't cause a major lung problem. Question 15. A nurse is administering a scheduled medication to a client. Which of the following is the most important step to ensure medication safety? A. Documenting the medication immediately after administration. B. Asking the client to state their name and date of birth. C. Checking the medication expiration date. D. Confirming the medication order with the prescriber. Answer B. Asking the client to state their name and date of birth. The question focuses on ensuring medication safety, and the key phrase is most important step. The right client is the cornerstone of safe medication administration. Asking the client to verbally confirm their name and date of birth is the most direct and effective way to verify their identity before giving any medication, preventing potential administration errors. While documenting, checking expiration dates, and confirming orders are all crucial safety practices, verifying the patient's identity is the immediate precursor to administering the drug to the correct person. Think of it as the first check before you give anything. Always remember the right patient rule. That's your absolute first line of defense against medication errors. Question 16. A client with asthma is prescribed an inhaled corticosteroid. The nurse should instruct the client to A. Use the inhaler only when experiencing severe symptoms. B. Rinse their mouth with water after using the inhaler. C. Shake the inhaler vigorously before each use. D. Hold their breath for 10 seconds after inhaling the medication. Answer B. Rinse their mouth with water after using the inhaler. This question assesses understanding of proper technique for inhaled corticosteroids. The keywords are asthma and inhaled corticosteroid. Rinsing the mouth after using inhaled corticosteroids helps prevent oral candidiasis, thrush, a common side effect. Inhaled corticosteroids are typically used for long-term control, not just severe symptoms. They need to be shaken, and holding breath is for bronchodilators, not necessarily corticosteroids. Proper technique is crucial for effectiveness and minimizing side effects. For example, spitting out the medication after rinsing helps remove any residue. Remember to always rinse your mouth after using steroid inhalers to prevent yeast infections. Question 17. A nurse is providing discharge instructions to a client who had a laparoscopic cholecystectomy. The nurse should instruct the client to A. Avoid all fatty foods indefinitely. B. Report any yellowing of the skin or eyes immediately. C. Expect some abdominal pain for up to 2 weeks. D. Limit fluid intake to prevent complications. Answer B. Report any yellowing of the skin or eyes immediately. The question is about discharge instructions after a laparoscopic cholecystectomy, gallbladder removal. The crucial phrase is report any yellowing of the skin or eyes. Yellowing of the skin or eyes, known as jaundice, can indicate a bile duct obstruction or leak, which is a serious complication that needs immediate medical attention after gallbladder surgery. While some abdominal discomfort is expected, it's usually not for 2 weeks, and while a low-fat diet is recommended initially, avoiding all fats indefinitely is usually not necessary. Limiting fluids is also incorrect. For example, if your skin starts looking yellow after surgery, it's a sign something is wrong with the bile system. Always remember that jaundice after gallbladder surgery is a red flag needing urgent assessment. Question 18. A client is experiencing an electrolyte imbalance and the nurse suspects hypokalemia. Which of the following clinical manifestations would the nurse anticipate? A. Muscle cramps and tetany. B. Weak pulse and constipation. C. Polydipsia and polyuria. D. Hyperactive bowel sounds and diarrhea. Answer B. Weak pulse and constipation. This question tests the knowledge of clinical manifestations of hypokalemia, low potassium levels. Key terms are electrolyte imbalance and hypokalemia. Hypokalemia affects neuromuscular function, leading to symptoms like muscle weakness, fatigue, and constipation due to decreased bowel motility. It can also cause cardiac irregularities, such as a weak pulse. Muscle cramps and tetany are more indicative of hypocalcemia. Polydipsia/polyuria suggest diabetes insipidus or mellitus, and hyperactive bowel sounds are not typical of hypokalemia. For example, if someone's potassium is very low, they might feel weak and have trouble having a bowel movement. Remember that low potassium can make your muscles and your gut slow down. Question 19. A nurse is caring for a client with a new diagnosis of schizophrenia. The nurse should anticipate that the client may experience which of the following symptoms? A. Elevated mood and decreased need for sleep. B. Grandiose delusions and inflated self-esteem. C. Auditory hallucinations and disorganized speech. D. Intrusive thoughts and recurrent memories. Answer: C. Auditory hallucinations and disorganized speech. The question asks about expected symptoms of schizophrenia. The key term is schizophrenia. Auditory hallucinations, hearing voices, and disorganized speech, incoherent or illogical communication, are hallmark positive symptoms of schizophrenia, which are additions to normal experience. Elevated mood and grandiose delusions are more characteristic of bipolar disorder, mania, and intrusive thoughts/recurrent memories are indicative of PTSD. For example, hearing voices when no one is speaking is a common experience for people with schizophrenia. A good tip is to associate schizophrenia with disruptions in thought, perception, and speech. Question 20. A client is receiving chemotherapy and develops mucositis, which is inflammation of the mucous membranes. The nurse should recommend which of the following interventions? A. Using an alcohol-based mouthwash regularly. B. Rinsing the mouth with a mild, non-alcoholic solution. C. Eating spicy and acidic foods to stimulate healing. D. Drinking hot liquids to soothe the throat. Answer: B. Rinsing the mouth with a mild, non-alcoholic solution. The question addresses managing mucositis, a common side effect of chemotherapy. The keywords are chemotherapy and mucositis. Alcohol-based mouthwashes can further irritate inflamed mucous membranes, and spicy, acidic foods or hot liquids will also worsen the discomfort. A mild, non-alcoholic mouth rinse, often saline or a baking soda solution, helps keep the mouth clean and moist without causing additional irritation, promoting healing. For example, gently swishing with salt water can clean the mouth without causing pain. Remember to be gentle with your mouth when it's sore from treatment. Question 21. A nurse is assessing a client who reports experiencing chest pain. Which of the following questions is most important to ask to assess for cardiac-related chest pain? A. When did the pain start? B. Does the pain radiate to your arm or jaw? C. Have you been under a lot of stress lately? D. What were you doing when the pain began? Answer: B. Does the pain radiate to your arm or jaw? This question focuses on distinguishing cardiac chest pain from other causes. The keywords are chest pain and cardiac-related. Radiation of chest pain to the arm, jaw, neck, or back is a classic symptom often associated with myocardial infarction, heart attack, or angina. While the other questions are relevant for a comprehensive pain assessment, the radiation pattern is a particularly strong indicator of a cardiac origin. For example, pain that travels down the left arm is a very common sign of heart trouble. A helpful tip is to remember that where chest pain goes can tell you a lot about its cause, especially if it goes to your arm or jaw. Question 22. A client is recovering from a myocardial infarction, MI. The nurse should instruct the client on the importance of A. Limiting fluid intake to prevent cardiac overload. B. Avoiding all physical activity to protect the heart. C. Adhering to prescribed medications, such as beta blockers and statins. D. Eating a diet high in sodium to help with fluid balance. Answer: C. Adhering to prescribed medications, such as beta blockers and statins. The question pertains to the post-myocardial infarction, MI, care. The key terms are myocardial infarction and importance. Adhering to prescribed medications like beta blockers to reduce heart workload and statins to lower cholesterol and stabilize plaques is crucial for recovery and preventing future cardiac events. Limiting fluids is not typically recommended unless there's heart failure, avoiding all activity is detrimental to recovery, and a high-sodium diet is contraindicated for cardiac health. For instance, taking your heart medicine as directed is one of the most important things you can do after a heart attack. Remember that consistency with your cardiac medications is key to a good recovery. Question 23. A nurse is administering a subcutaneous injection of insulin. Which of the following is the correct angle of insertion for the needle? A. 30 degrees. B. 45 degrees. C. 60 degrees. D. 90 degrees. Answer: D. 90 degrees. This question assesses proper technique for subcutaneous injections. The keywords are subcutaneous injection and angle of insertion. For most adults and average-sized individuals, a 90-degree angle is appropriate for subcutaneous injections when using a standard-length needle, as it ensures the medication is deposited into the subcutaneous fat layer. If the client is very thin or a shorter needle is used, a 45-degree angle might be considered, but 90 degrees is generally preferred for standard insulin administration. For example, when giving yourself insulin, you usually stick the needle straight in. Here's an easy way to remember: for most shots under the skin, straight in, 90 degrees, is the way to go. Question 24. A client is admitted with pneumonia. The nurse should prioritize which intervention to improve oxygenation? A. Administering prescribed cough suppressants. B. Encouraging deep breathing and coughing exercises. C. Elevating the head of the bed to a flat position. D. Restricting fluid intake to decrease pulmonary congestion. Answer: B. Encouraging deep breathing and coughing exercises. The question focuses on improving oxygenation in a client with pneumonia. The key terms are pneumonia and improve oxygenation. Deep breathing and coughing exercises help to mobilize secretions, clear the airways, and improve lung expansion, all of which enhance oxygenation. Cough suppressants are generally avoided in pneumonia as coughing helps clear the lungs. Elevating the head of the bed to a semi-Fowler's or high Fowler's position, not flat, improves lung expansion, and fluid restriction would be counterproductive as hydration helps thin secretions. For example, taking deep breaths and coughing helps get the gunk out of your lungs. Remember that clearing your airways is vital for breathing better when you have pneumonia. Question 25. A nurse is assessing a client diagnosed with hypothyroidism. Which of the following symptoms would the nurse expect to find? A. Diarrhea and weight loss. B. Heat intolerance and anxiety. C. Bradycardia and fatigue. D. Tremors and palpitations. Answer: C. Bradycardia and fatigue. This question tests knowledge of the clinical manifestations of hypothyroidism, underactive thyroid E. The keyword is hypothyroidism. Hypothyroidism slows down the body's metabolism, leading to symptoms such as bradycardia, slow heart rate, fatigue, weight gain, cold intolerance, and constipation. Diarrhea, heat intolerance, anxiety, tremors, and palpitations are more indicative of hyperthyroidism, overactive thyroid E. For example, if your thyroid isn't working enough, you'll likely feel tired and have a slow heart rate. Think of hypothyroidism as the body's engine running too slow. Question 26. A client is experiencing severe nausea and vomiting due to chemotherapy. The nurse should anticipate that the prescriber will order which class of medication? A. Diuretics. B. Antiemetics. C. Laxatives. D. Sedatives. Answer B. Antiemetics. The question asks about medication for nausea and vomiting. The key terms are nausea and vomiting and chemotherapy. Antiemetics are medications specifically designed to prevent or relieve nausea and vomiting. Diuretics are for fluid management, laxatives for constipation, and sedatives for calming or sleep, none of which directly address chemotherapy-induced nausea and vomiting. For example, antiemetic drugs are given to stop you from feeling sick when you're having certain treatments. Remember that antiemetic means it fights against vomiting. Question 27. A client has a tracheostomy tube in place. The nurse is providing suctioning. Which of the following is a critical step during suctioning to prevent hypoxia? A. Suctioning for longer than 30 seconds at a time. B. Applying suction continuously while inserting the catheter. C. Hyperoxygenating the client before suctioning. D. Yankauer suctioning only. Answer C. Hyperoxygenating the client before suctioning. The question focuses on preventing hypoxia, lack of oxygen, during tracheostomy suctioning. The keywords are tracheostomy, suctioning, and hypoxia. Hyperoxygenating the client by providing extra oxygen before suctioning helps maintain adequate oxygen levels in the blood during the procedure, as suctioning can temporarily reduce oxygen. Suctioning for too long, applying continuous suction while inserting, or using only a Yankauer, rigid E, catheter without sterile technique can all be detrimental or ineffective. For instance, giving extra breaths of oxygen before suctioning helps make sure your body has enough oxygen during the process. A key tip is to always top off the oxygen supply before suctioning to prevent a drop in oxygen levels. Question 28. A nurse is teaching a client about managing heart failure. Which of the following dietary recommendations is most appropriate? A. Increase sodium intake to maintain fluid balance. B. Restrict fluid intake to 1 liter per day. C. Consume a low-sodium diet. D. Eat a diet high in potassium. Answer C. Consume a low-sodium diet. This question addresses dietary management for heart failure. The keyword heart failure is central. In heart failure, the heart struggles to pump blood effectively, leading to fluid buildup. Sodium causes the body to retain fluid, so a low-sodium diet is crucial to reduce fluid overload and ease the workload on the heart. Fluid restriction may also be necessary, but a low-sodium diet is the primary dietary intervention. High potassium might be advised depending on medications, but sodium restriction is universally important. For example, cutting back on salty foods helps your body hold onto less water, which is good for your heart. Remember that low sodium helps your heart work better by reducing fluid buildup. Question 29. A client is receiving an intravenous infusion of potassium chloride. The nurse should monitor for which of the following adverse effects? A. Hyperkalemia and cardiac dysrhythmias. B. Hypokalemia and muscle twitching. C. Hyponatremia and fluid overload. D. Hypoglycemia and confusion. Answer A. Hyperkalemia and cardiac dysrhythmias. The question concerns adverse effects of administering potassium chloride intravenously. The keyword is potassium chloride. Administering potassium, especially too quickly or in too high a dose, can lead to hyperkalemia, elevated potassium levels. Hyperkalemia can disrupt the heart's electrical activity, causing potentially life-threatening cardiac dysrhythmias. Hypokalemia is the opposite, and the other options relate to different electrolyte or metabolic imbalances. For instance, giving too much potassium can make your heart beat irregularly. A critical takeaway is that potassium needs careful monitoring because it can easily affect your heart. Question 30. A nurse is assessing a client who underwent a thyroidectomy. Which of the following findings requires immediate intervention? A. Mild hoarseness of the voice. B. A sensation of throat tightness. C. Presence of a surgical drain with serosanguinous fluid. D. Complaint of sore throat when swallowing. Answer B. A sensation of throat tightness. The question focuses on immediate post-thyroidectomy concerns. The key terms are thyroidectomy and immediate intervention. A sensation of throat tightness or difficulty breathing can indicate laryngeal edema or damage to the recurrent laryngeal nerve, which can lead to airway obstruction, a life-threatening emergency. Mild hoarseness and a sore throat are common and usually resolve. Serosanguinous fluid in the drain is also expected. For example, if you feel like your throat is closing up after thyroid surgery, it's a sign to get help right away. Remember that any feeling of throat tightness after thyroid surgery is a potential emergency. Question 31. A client has a prescription for a nitroglycerin sublingual tablet. The nurse should instruct the client to A. Swallow the tablet whole with a glass of water. B. Chew the tablet to ensure rapid absorption. C. Place the tablet under the tongue and allow it to dissolve. D. Crush the tablet and mix it with applesauce. Answer C. Place the tablet under the tongue and allow it to dissolve. This question is about the correct administration of sublingual nitroglycerin. The keywords are nitroglycerin sublingual tablet. Sublingual means under the tongue, and this route is used for rapid absorption directly into the bloodstream, bypassing the digestive system. Allowing the tablet to dissolve under the tongue provides quick relief of angina pain. Swallowing, chewing, or crushing it would alter its absorption and effectiveness. For instance, you put nitroglycerin under your tongue, and it melts away quickly to help your chest pain. Remember that sublingual means it goes under the tongue to work fast. Question 32. A client is prescribed amiodarone, an antiarrhythmic medication. The nurse should monitor the client for which of the following potential serious adverse effects? A. Hypertension and bradycardia. B. Hypoglycemia and weight gain. C. Pulmonary fibrosis and thyroid dysfunction. D. Renal failure and electrolyte imbalance. Answer C. Pulmonary fibrosis and thyroid dysfunction. The question focuses on the serious adverse effects of amiodarone, an antiarrhythmic drug. The keywords are amiodarone and potential serious adverse effects. Amiodarone has a black box warning for potential pulmonary toxicity, pulmonary fibrosis, and thyroid dysfunction, both hypo and hyperthyroidism, due to its iodine content. While it can affect heart rate and blood pressure, these specific organ toxicities are particularly concerning and require close monitoring. The other options are not the primary serious concerns associated with amiodarone. For example, long-term use of amiodarone can sometimes damage your lungs or affect your thyroid. A critical tip to remember is that amiodarone can cause lung and thyroid problems, so regular checks are essential. Question 33. A nurse is assessing a client with possible appendicitis. Which assessment finding is most indicative of this condition? A. Generalized abdominal pain that is worse in the left lower quadrant. B. Persistent, severe pain that begins in the periumbilical area and moves to the right lower quadrant. C. Diarrhea and abdominal cramping relieved by bowel movements. D. Constipation and bloating without significant abdominal pain. Answer B. Persistent, severe pain that begins in the periumbilical area and moves to the right lower quadrant. The question is about identifying a key symptom of appendicitis. The keywords are appendicitis and most indicative. The classic presentation of appendicitis involves periumbilical pain, pain around the navel, that migrates to the right lower quadrant, RLQ, of the abdomen and often becomes more severe. Generalized pain, pain in the left lower quadrant, diarrhea, or constipation without significant pain are not as characteristic of appendicitis. For example, if your belly button pain moves to the lower right side and gets really bad, it's a strong sign of appendicitis. Remember that the migrating pain in appendicitis is a classic clue. Question 34. A client is prescribed furosemide, a loop diuretic. The nurse should monitor the client for which of the following electrolyte imbalances? A. Hypernatremia and hyperkalemia. B. Hyponatremia and hypokalemia. C. Hypercalcemia and hypermagnesemia. D. Hypocalcemia and hypomagnesemia. Answer B. Hyponatremia and hypokalemia. This question tests knowledge of the adverse effects of furosemide, a loop diuretic. The keywords are furosemide and electrolyte imbalances. Loop diuretics work by inhibiting the reabsorption of sodium and potassium in the kidneys, leading to increased excretion of these electrolytes in the urine. Therefore, hyponatremia, low sodium, and hypokalemia, low potassium, are common and important side effects to monitor. Hypernatremia and hyperkalemia are the opposite, and the other options relate to calcium and magnesium imbalances, which are also risks but less consistently than sodium and potassium. For instance, taking furosemide can make you lose too much sodium and potassium. A helpful tip is to remember that loop diuretics can steal sodium and potassium from your body. Question 35. A nurse is preparing to administer an enema to a client. Which of the following is the most important safety consideration? A. Administering the enema solution at body temperature. B. Inserting the enema tip more than 6 inches into the rectum. C. Telling the client to hold their breath during insertion. D. Using a large volume, high-pressure enema for faster results. Answer A. Administering the enema solution at body temperature. The question addresses safety considerations for enema administration. The keyword is safety consideration. Administering enema solution at body temperature, around 100 to 105 degrees Fahrenheit or 38 to 45 degrees C, is crucial to prevent thermal injury to the rectal mucosa or intestines, as well as to avoid causing cramping or shock. Inserting the tip too far can injure the rectal wall, holding breath is not helpful, and high-pressure/volume enemas can cause damage. For example, if the enema liquid is too hot or too cold, it can hurt the inside of your body. Remember that the temperature of the enema solution is vital for patient safety. Question 36. A client is receiving a continuous intravenous infusion of heparin. The nurse should monitor which laboratory test to assess the effectiveness of heparin therapy? A. Prothrombin time, PT. B. Activated partial thromboplastin time, APTT. C. International normalized ratio, INR. D. Bleeding time. Answer, B. Activated partial thromboplastin time, APTT. This question tests knowledge of monitoring unfractionated heparin therapy. The keyword heparin is the primary clue. Heparin works by activating antithrombin 3, which inactivates thrombin and factor XA, thereby prolonging the time it takes for blood to clot. The activated partial thromboplastin time, APTT, is the laboratory test that specifically measures the intrinsic and common pathways of the coagulation cascade and is used to monitor the therapeutic efficacy of unfractionated heparin. PT and INR are used for warfarin monitoring, and bleeding time is a general measure of platelet function. For example, doctors check your APTT to make sure the heparin is working right. A good tip to remember is that heparin equals APTT. Question 37. A nurse is assessing a client who has a history of seizures. The nurse should include which of the following questions in the assessment? A. Do you experience any visual disturbances before a seizure? B. Have you noticed any changes in your appetite recently? C. How often do you brush your teeth? D. Do you prefer to sleep on your side or your back? Answer. A. Do you experience any visual disturbances before a seizure? The question focuses on assessing a client with a history of seizures, looking for pre-seizure symptoms. The keywords are seizures and assessment. Visual disturbances, such as flashing lights or blind spots, can be an aura or warning sign that a seizure is about to occur. Changes in appetite, dental hygiene, or sleeping position are not directly related to seizure prediction or management. For example, seeing strange lights before you lose consciousness can be a sign a seizure is coming. Remember that an aura is something you might feel or see right before a seizure starts. Question 38. A client is recovering from a coronary artery bypass graft, CABG, surgery. The nurse should monitor for which of the following common postoperative complications? A. Hypovolemic shock. B. Pneumonia. C. Hypernatremia. D. Bradycardia. Answer, B. Pneumonia. The question is about common postoperative complications after CABG surgery. The keywords are CABG surgery and common postoperative complications. Clients undergoing CABG are at increased risk for pneumonia due to immobility, anesthesia, and potential accumulation of secretions in the lungs. Hypovolemic shock is a risk but less common than pneumonia. Hypernatremia and bradycardia are not typically common post-CABG complications. For example, being less mobile after surgery can make it easier for lung infections to develop. A helpful tip is to think about how lying in bed can make it harder for your lungs to stay clear. Question 39. A nurse is administering a blood product. Which of the following is the most critical nursing action to perform before starting the transfusion? A. Ensure the client has an intravenous access site. B. Verify the client's identity and the blood product information. C. Administer a dose of acetaminophen. D. Check the client's temperature. Answer, B. Verify the client's identity and the blood product information. This question emphasizes the critical safety step before administering blood products. The keywords are blood product and most critical nursing action. Verifying the client's identity and matching it precisely with the information on the blood unit, such as ABO type, RH factor, and unit number, is the most crucial action to prevent a life-threatening hemolytic transfusion reaction. While having for access and checking the temperature are important, the identity and blood product verification are paramount. Administering acetaminophen proactively is not standard practice. For example, double-checking that the blood bag belongs to the right patient is the most important thing you can do. Remember, matching the patient to the blood is the first and most critical safety check. Question 40. A client is experiencing symptoms of a urinary tract infection, UTI. The nurse should instruct the client to A. Drink alcohol to help cleanse the urinary tract. B. Hold urine for extended periods to reduce frequency. C. Increase fluid intake, especially water. D. Avoid acidic foods and beverages. Answer, C. Increase fluid intake, especially water. The question focuses on self-care instructions for a UTI. The keywords are urinary tract infection and instruct the client. Increasing fluid intake, particularly water, helps to dilute urine and flush bacteria out of the urinary tract, which is essential for treating and preventing UTIs. Alcohol and caffeine can irritate the bladder, and holding urine can allow bacteria to multiply. While avoiding acidic foods might be recommended by some, increased fluid intake is the most universally important intervention. For example, drinking lots of water helps wash away the germs causing the infection. Remember that flushing your system with fluids is key to clearing a UTI. Question 41. A nurse is caring for a client with a diagnosis of heart failure. The nurse should assess the client for which of the following signs of fluid overload? A. Dry mucous membranes and decreased skin turgor. B. Elevated blood pressure and bounding pulse. C. Jugular vein distension and peripheral edema. D. Decreased respiratory rate and shallow breathing. Answer, C. Jugular vein distension and peripheral edema. The question asks about signs of fluid overload in a client with heart failure. The keywords are heart failure and fluid overload. In heart failure, the heart is unable to pump blood effectively, leading to a backup of fluid. Jugular vein distension, swelling of the neck veins, and peripheral edema, swelling in the extremities, like the ankles and feet, are classic signs that indicate the body is retaining excess fluid. Dry mucous membranes and decreased skin turgor suggest dehydration, not fluid overload. Elevated BP and bounding pulse can be signs of fluid overload, but JVD and edema are more specific indicators of the venous congestion. Decreased respiratory rate is not a typical sign. For example, if you see swelling in your legs or bulging veins in your neck, it means you have too much fluid in your body. A helpful reminder is that fluid overload shows up as visible swelling in your body. Question 42. A client is prescribed aspirin for the prevention of cardiovascular events. The nurse should instruct the client to report which of the following adverse effects? A. Increased energy levels. B. Bruising or bleeding. C. Decreased appetite. D. Dry mouth. Answer, B. Bruising or bleeding. This question focuses on the adverse effects of aspirin, an antiplatelet medication. The keywords are aspirin and adverse effects. Aspirin inhibits platelet aggregation, which reduces the risk of clot formation but also increases the risk of bleeding. Therefore, bruising or any signs of bleeding, like blood in the stool or urine, are important adverse effects to report. Increased energy, decreased appetite, and dry mouth are not typically associated with aspirin's therapeutic or adverse effects. For example, if you notice you're bruising more easily after starting aspirin, it's important to tell your doctor. Remember that aspirin can make you bleed more easily. Question 43. A nurse is assessing a client who is experiencing an acute asthma exacerbation. Which of the following breath sounds would the nurse most likely hear? A. Crackles. B. Ronchi. C. Wheezes. D. Stridor. Answer: C. Wheezes. The question asks to identify the characteristic breath sound during an acute asthma exacerbation. The key terms are asthma exacerbation and breath sounds. Wheezing is a high-pitched whistling sound caused by narrowed airways due to bronchospasm and inflammation, which is a hallmark of asthma. Crackles are typically heard in pneumonia or heart failure, rhonchi in bronchitis or secretions in larger airways, and stridor is a harsh, vibrating sound usually heard in upper airway obstruction. For example, if someone with asthma is having trouble breathing, you'll often hear a high-pitched whistling sound when they exhale. Remember that wheezing is the sound of tight airways in asthma. Question 44. A client is receiving a blood transfusion and develops a fever, chills, and back pain shortly after it begins. The nurse should immediately A. Continue the transfusion at a slower rate. B. Administer an antipyretic. C. Stop the transfusion and notify the healthcare provider. D. Increase the rate of the fluid infusion. Answer: C. Stop the transfusion and notify the healthcare provider. This question addresses a critical intervention when a suspected transfusion reaction occurs. The keywords are blood transfusion and fever, chills, and back pain, which are classic signs of a hemolytic transfusion reaction. The most critical action is to immediately stop the transfusion to prevent further exposure to incompatible blood. Then, notifying the healthcare provider is essential for further assessment and management. Continuing the transfusion, administering an antipyretic without stopping, or increasing fluid infusion would all be inappropriate and potentially harmful. For example, if someone starts feeling sick and having chills during a blood transfusion, the first thing you do is stop the blood. Always remember that stopping the transfusion is the immediate priority if you suspect a reaction. Question 45. A client is prescribed metformin for type 2 diabetes. The nurse should instruct the client to A. Take the medication on an empty stomach to improve absorption. B. Report any muscle pain or weakness immediately. C. Drink plenty of fluids, especially during exercise. D. Avoid consuming grapefruit and grapefruit juice. Answer: C. Drink plenty of fluids, especially during exercise. The question focuses on important instructions for a client taking metformin. The keywords are metformin and instruct the client. Metformin can increase the risk of lactic acidosis, a rare but serious side effect, particularly in clients who are dehydrated or have impaired kidney function. Therefore, staying well hydrated is crucial, especially during physical activity. Taking metformin with food can help reduce gastrointestinal side effects. Muscle pain or weakness is not a common side effect that needs immediate reporting for metformin, it's more associated with statins. Grapefruit interaction is more common with certain statins and calcium channel blockers. For example, drinking enough water helps protect your kidneys when you're taking metformin. Remember that staying hydrated is very important when you're on metformin. Question 46. A nurse is assessing a client who is postoperative day 1 after a total knee arthroplasty. Which of the following is an expected finding? A. Significant edema in the operative leg. B. Inability to move the toes. C. Presence of a palpable pedal pulse. D. Numbness and tingling in the foot. Answer: C. Presence of a palpable pedal pulse. The question asks for an expected finding in a client 1 day after a total knee arthroplasty. The keywords are total knee arthroplasty and expected finding. A palpable pedal pulse, a pulse felt in the foot, indicates adequate circulation to the extremity, which is essential. Some edema in the operative leg is expected due to surgery and inflammation, but significant, uncontrolled edema could be a concern. Inability to move toes or numbness/tingling could indicate nerve compromise or impaired circulation, which would be complications. For example, feeling your pulse in your foot is a good sign that blood is flowing well to your leg. Remember that a good pulse in your foot means your leg is getting enough blood. Question 47. A client is admitted with symptoms of dehydration. The nurse should anticipate an order for which type of intravenous fluid? A. 5% dextrose in water, D5W. B. 0.9% sodium chloride, normal saline. C. 3% sodium chloride. D. 10% dextrose in water, D10W. Answer, B. 0.9% sodium chloride, normal saline. The question is about managing dehydration with intravenous fluids. The keyword is dehydration. Normal saline, 0.9% sodium chloride, is an isotonic solution, meaning it has the same concentration of solutes as the blood. Isotonic solutions are the primary choice for expanding extracellular fluid volume and are effective for treating dehydration and hypovolemia because they do not cause significant fluid shifts into or out of cells. D5W becomes hypotonic once dextrose is metabolized. 3% saline is hypertonic and used cautiously for severe hyponatremia, and D10W is hypertonic. For example, normal saline is like giving your body back the fluids it's lost. Remember that normal saline is the go-to fluid for rehydrating the body. Question 48. A nurse is caring for a client with a new colostomy. The nurse should teach the client about the importance of A. Emptying the ostomy pouch when it is half full. B. Irrigating the colostomy daily to promote bowel regularity. C. Changing the ostomy pouch every 2 to 3 days regardless of leakage. D. Using harsh soaps to clean the skin around the stoma. Answer. A. Emptying the ostomy pouch when it is half full. This question focuses on teaching a client with a new colostomy. The keywords are colostomy and importance of. Emptying the ostomy pouch when it is about half full prevents the pouch from becoming too heavy and pulling away from the skin, which could lead to leakage and skin irritation. Daily irrigation is not always necessary and depends on the type of colostomy. Changing the pouch is based on seal integrity and leakage, not a fixed schedule. Harsh soaps can damage the skin. For example, you don't want the bag to get so full that it starts to pull away from your skin. A good tip is to empty the bag before it gets too heavy to avoid problems. Question 49. A nurse is assessing a client who is post-operative day 2 after abdominal surgery. The client reports, "I haven't had a bowel movement since before the surgery." The nurse should assess for which of the following potential complications? A. Intestinal obstruction. B. Wound dehiscence. C. Pneumonia. D. Deep vein thrombosis. Answer. A. Intestinal obstruction. The question asks about potential complications after abdominal surgery, focusing on bowel function. The keywords are abdominal surgery and haven't had a bowel movement. A lack of bowel movement, especially after abdominal surgery where the bowel may be manipulated or affected by anesthesia and pain medication, can be a sign of paralytic ileus or an intestinal obstruction. Wound dehiscence relates to the surgical incision, pneumonia to the lungs, and DVT to blood clots, none of which are directly indicated by the absence of a bowel movement. For example, if your intestines aren't working properly after surgery, you won't be able to pass gas or have a bowel movement. Remember that a lack of bowel function after abdominal surgery could mean your intestines are blocked or temporarily shut down. Question 50. A client is prescribed a medication that requires therapeutic drug monitoring. Which of the following is the primary reason for this type of monitoring? A. To ensure the medication is being taken consistently. B. To determine the optimal dose to achieve desired effects while minimizing toxicity. C. To identify potential allergic reactions to the medication. D. To assess the client's understanding of the medication's purpose. Answer B. To determine the optimal dose to achieve desired effects while minimizing toxicity. The question asks about the primary purpose of therapeutic drug monitoring. The keywords are therapeutic drug monitoring and primary reason. Therapeutic drug monitoring involves measuring the concentration of a drug in the blood to ensure it falls within a specific range that is effective for treatment, therapeutic range, but below the level that causes toxic effects. This helps tailor the dosage to the individual client. While consistency and understanding are important, they are not the direct purpose of monitoring blood levels. Allergic reactions are usually identified through clinical observation. For example, blood tests help doctors figure out exactly how much of a medicine you need to get better without getting sick from it. Remember that drug monitoring is all about finding the sweet spot for your medication dose. Question 51. A nurse is caring for a client with a fever and productive cough. The nurse suspects pneumonia. Which intervention is most important for preventing the spread of infection? A. Administering antibiotics as prescribed. B. Ensuring the client adheres to droplet precautions. C. Encouraging fluid intake to thin secretions. D. Elevating the head of the bed. Answer B. Ensuring the client adheres to droplet precautions. The question focuses on infection control for a client with suspected pneumonia. The keywords are pneumonia and preventing the spread of infection. Pneumonia is often spread through respiratory droplets. Implementing droplet precautions, which include wearing a mask and ensuring visitors wear one, is the most critical step to prevent transmission to others. While administering antibiotics, encouraging fluids, and elevating the bed are important for the client's recovery, droplet precautions are specifically for infection control. For example, wearing a mask when you're coughing helps stop germs from spreading to other people. Remember that precautions are put in place to protect everyone else from getting sick. Question 52. A client is prescribed warfarin and needs to have an oral surgery. The nurse knows that which of the following may be required before the procedure? A. Discontinuing warfarin 24 hours prior. B. Administering vitamin K intramuscularly. C. Temporarily holding warfarin and possibly switching to a short-acting anticoagulant. D. Increasing the dose of warfarin. Answer C. Temporarily holding warfarin and possibly switching to a short-acting anticoagulant. This question addresses the management of warfarin in relation to surgery. The keywords are warfarin and oral surgery. Warfarin is an anticoagulant that increases bleeding risk. For elective procedures like oral surgery, it's often necessary to temporarily stop warfarin to reduce bleeding. Depending on the client's risk for clotting, they might be switched to a shorter-acting anticoagulant, like heparin or low-molecular-weight heparin, during the hold period. Discontinuing too close to surgery or increasing the dose would increase bleeding or clotting risk, respectively. Vitamin K is an antidote but is usually reserved for excessive bleeding or reversal, not routine preoperative management. For example, if you're on blood thinner and need surgery, your doctor might tell you to stop taking it for a few days beforehand. Remember that stopping blood thinners before surgery is common to prevent too much bleeding. Question 53. A nurse is assessing a client who is receiving a continuous infusion of a vasopressor medication. Which of the following is the most important intervention to prevent extravasation? A. Infusing the medication through a central venous catheter. B. Regularly monitoring the infusion site for redness or swelling. C. Administering a bolus of normal saline before the infusion. D. Increasing the infusion rate if the client's blood pressure drops. Answer B. Regularly monitoring the infusion site for redness or swelling. The question is about preventing extravasation, which is the leakage of an irritant medication into surrounding tissues. The keywords are vasopressor and extravasation. Vasopressors are potent medications that can cause severe tissue damage if they leak from the vein. Regular monitoring of the foresite for signs of infiltration or extravasation, such as redness, swelling, pain, or coolness, is critical. Ideally, these medications are administered via a central venous catheter, but diligent monitoring of a peripheral site is essential if a central line is not available. Increasing the rate could worsen the extravasation. For example, you need to watch the foresite closely to make sure the medicine isn't leaking out. A good tip is to check the foresite often for any signs of trouble like swelling. Question 54. A client is experiencing diarrhea. The nurse should instruct the client to avoid which of the following foods? A. Bananas. B. Rice. C. Applesauce. D. Fried chicken. Answer D. Fried chicken. The question asks for food to avoid during diarrhea. The keywords are diarrhea and avoid. Foods that are high in fat, like fried chicken, are difficult to digest and can worsen diarrhea. The brat diet, bananas, rice, applesauce, toast, is often recommended for diarrhea because these foods are bland, low in fiber, and binding, helping to firm up stools. For example, fatty foods can upset your stomach and make diarrhea worse. Remember that greasy or fried foods are usually a no-go when you have an upset stomach. Question 55. A client is prescribed lisinopril, an ACE inhibitor. The nurse should teach the client to report which of the following potential adverse effects? A. Edema of the feet. B. A dry, persistent cough. C. Frequent urination. D. Increased appetite. Answer B. A dry, persistent cough. This question focuses on a common adverse effect of ACE inhibitors like lisinopril. The keywords are lisinopril and potential adverse effects. A dry, hacking cough is a well-known and relatively common side effect of ACE inhibitors, caused by the accumulation of bradykinin. While edema of the feet can occur with some cardiovascular medications, it's not a typical ACE inhibitor side effect. Frequent urination might occur with diuretics, and increased appetite is not a common side effect. For example, a persistent dry cough is something you might get from taking blood pressure medicine like lisinopril. A helpful tip is to remember that a dry cough is a signature side effect of ACE inhibitors. Question 56. A nurse is caring for a client with a diagnosis of COPD. Which of the following positions would be most beneficial to ease the client's dyspnea? A. Supine with the head of the bed flat. B. Prone position. C. High Fowler's position. D. Trendelenburg position. Answer C. High Fowler's position. The question asks for the most beneficial position for a client with COPD experiencing dyspnea, difficulty breathing. The keywords are COPD and dyspnea. The high Fowler's position, where the head of the bed is elevated to 60 to 90 degrees, allows for maximum lung expansion by reducing pressure on the diaphragm. This facilitates breathing. A supine position with the bed flat prone position, or Trendelenburg position would likely worsen dyspnea by compressing the lungs. For example, sitting up straight makes it easier to take a deep breath when you have trouble breathing. Remember that sitting up high helps you breathe better. Question 57. A client is recovering from a hip fracture and is prescribed a low molecular weight heparin, LMWH, such as enoxaparin. The nurse should instruct the client to report which of the following? A. Increased energy levels. B. Mild bruising at the injection site. C. Signs of bleeding, such as dark, tarry stools. D. Reduced pain in the hip. Answer, C. Signs of bleeding, such as dark, tarry stools. The question focuses on safety instructions for a client taking low molecular weight heparin, LMWH. The keywords are low molecular weight heparin and report which of the following. LMWHs are anticoagulants, meaning they prevent blood clots but also increase the risk of bleeding. Therefore, clients should be taught to report any signs of bleeding, such as bruising, nosebleeds, blood in the urine or stool. Dark, tarry stools are an indicator of GI bleeding or prolonged bleeding from cuts. Mild bruising at the injection site is a common and expected local reaction. Increased energy and reduced pain are positive outcomes, not adverse effects. For example, if you notice blood in your poop after taking blood thinner medicine, you need to tell your doctor right away. A key tip is to watch out for any signs that you might be bleeding too much. Question 58. A nurse is caring for a client receiving a general anesthetic. Which of the following is a critical safety concern for this client during the postoperative period? A. Development of a fever. B. Increased appetite. C. Respiratory depression. D. Increased bowel sounds. Answer, C. Respiratory depression. The question addresses critical postoperative safety concerns related to general anesthesia. The keywords are general anesthetic and critical safety concern. General anesthetics depress the central nervous system, including the respiratory drive. Therefore, respiratory depression, leading to shallow breathing and reduced oxygen saturation, is a significant and common postoperative complication that requires vigilant monitoring. Fever can occur but is not as immediately critical as respiratory depression. Increased appetite and increased bowel sounds are generally positive signs of recovery. For example, anesthesia can make your breathing slow down, which is why nurses check it carefully after surgery. Remember that breathing is the top priority after anesthesia. Question 59. A client is experiencing symptoms of hypoglycemia. The nurse should anticipate which of the following symptoms? A. Polydipsia and polyuria. B. Fatigue and blurred vision. C. Diaphoresis and confusion. D. Warm, dry skin and Kussmaul respirations. Answer, C. Diaphoresis and confusion. The question asks about signs of hypoglycemia, low blood sugar. The keywords are hypoglycemia and anticipate which of the following symptoms. Hypoglycemia occurs when blood glucose levels drop too low, depriving the brain of glucose. This can lead to symptoms like diaphoresis, sweating, confusion, shakiness, and palpitations. Polydipsia, excessive thirst, and polyuria, frequent urination, are classic symptoms of hyperglycemia, high blood sugar, as are warm, dry skin and Kussmaul respirations, deep, rapid breathing. Fatigue and blurred vision can occur with both high and low blood sugar, but diaphoresis and confusion are more specific to hypoglycemia. For example, if your blood sugar drops too low, you might start sweating a lot and feel confused. Remember that sweating and confusion are big clues that your blood sugar is too low. Question 60. A nurse is preparing to administer an intravenous piggyback, IV-B, medication. Which of the following is the correct procedure? A. Connect the IV-PB tubing directly into the client's foreline. B. Hang the IV-PB bag higher than the primary fore bag. C. Prime the IV-PB tubing with the primary fore fluid. D. Administer the IV-PB medication through the most distal port of the primary fore line. Answer, B. Hang the IV-PB bag higher than the primary fore bag. The question focuses on the correct procedure for administering an intravenous piggyback, IV-B, medication. The keyword is IV-PB medication. When administering an IV-PB, the bag containing the secondary medication is hung higher than the primary fore bag. This higher hydrostatic pressure allows the secondary fluid to infuse first by gravity. Connecting directly into the line without proper priming, priming with the primary fluid, or using the most distal port are incorrect procedures. For example, you put the smaller medicine bag higher up so that medicine goes in first. Remember that the higher bag gets to infuse first by gravity. Question 61. A nurse is assessing a client who is postoperative day 1 after a thyroidectomy. The nurse notes that the client's voice is hoarse and they complain of a sore throat. These findings are: A. Expected and usually resolve within a few days. B. Indicative of hypocalcemia. C. A sign of an allergic reaction to the anesthesia. D. Requiring immediate suctioning of the airway. Answer: A. Expected and usually resolve within a few days. The question asks about expected findings after a thyroidectomy. The keywords are thyroidectomy and hoarse voice and sore throat. Hoarseness and a sore throat are common after thyroid surgery due to swelling and irritation of the vocal cords and surrounding tissues from the endotracheal tube used during anesthesia. These symptoms are typically temporary and resolve on their own. They are not indicative of hypocalcemia, allergic reaction, or a need for immediate airway suctioning unless respiratory distress is present. For example, it's normal to have a scratchy throat and sound a bit hoarse after having your thyroid removed. Remember that a sore, hoarse throat is a common, temporary side effect of thyroid surgery. Question 62. A nurse is caring for a client with a newly inserted nasogastric, NG, tube for enteral feeding. Which of the following is the most important nursing action to ensure accurate placement? A. Checking the pH of the aspirate. B. Asking the client to speak. C. Measuring the length of the tube exposed outside the nose. D. Listening for bubbling sounds when air is injected. Answer: A. Checking the pH of the aspirate. This question addresses the most critical step in ensuring the correct placement of a nasogastric, NG, tube before feeding. The keywords are nasogastric, NG, tube and accurate placement. While listening for bubbling or measuring exposed tube length can be initial checks, the most reliable method to confirm NG tube placement into the stomach is by measuring the pH of the aspirate. Gastric fluid typically has a pH of 1.5-3, 5, while intestinal or lung fluid has a higher pH. Asking the client to speak is not a definitive placement check. For example, testing the fluid from the tube to see if it's acidic is the best way to know it's in your stomach. Remember that a low pH in the fluid from the tube means it's likely in the stomach. Question 63. A client is prescribed an opioid analgesic for severe pain. The nurse should monitor for which of the following adverse effects? A. Increased respiratory rate. B. Sedation and constipation. C. Dilated pupils. D. Diarrhea. Answer B. Sedation and constipation. The question focuses on adverse effects of opioid analgesics. The keywords are opioid analgesic and adverse effects. Opioids work by depressing the central nervous system, which can lead to sedation, drowsiness. They also significantly slow down gastrointestinal motility, resulting in constipation. Increased respiratory rate and dilated pupils are not typical adverse effects. Opioids usually cause a decreased respiratory rate and constricted, pinpoint, pupils. Diarrhea is the opposite of what opioids typically cause. For example, strong pain medicine can make you sleepy and cause you to not have a bowel movement. Remember that sleepiness and constipation are common side effects of opioid pain relievers. Question 64. A nurse is caring for a client who had a coronary artery bypass graft, CABG, surgery and is now on telemetry monitoring. The nurse notes the client's heart rate is 45 beats per minute. This finding requires A. Immediate discontinuation of the client's beta blocker medication. B. Assessment for symptoms of bradycardia, such as dizziness or syncope. C. Administering atropine without further assessment. D. Documenting the finding and continuing to monitor. Answer B. Assessment for symptoms of bradycardia, such as dizziness or syncope. The question asks for the appropriate nursing action when a client post-CABG shows a heart rate of 45 bpm. The keywords are CABG surgery, telemetry, and heart rate is 45 beats per minute. A heart rate of 45 bpm is considered bradycardia. While it can be related to medications like beta blockers, the priority is to assess the client for symptoms of inadequate cardiac output, such as dizziness, lightheadedness, or syncope, fainting, which indicate that the slow heart rate is causing a problem. Discontinuing medication or administering atropine should only be done by prescription or according to protocol after assessment. Simply documenting without assessing for symptoms would be insufficient. For example, a slow heart rate can sometimes make people feel faint or dizzy. Remember to check how the patient is feeling when their heart rate is unusually slow. Question 65. A client is receiving a continuous infusion of a medication. The nurse notices that the foresite is swollen, cool to the touch, and the client reports discomfort at the site. This is indicative of A. Infection. B. Phlebitis. C. Infiltration. D. Air embolism. Answer C. Infiltration. The question asks to identify the complication based on the described foresite assessment. The keywords are foresite, swollen, cool, and discomfort. These signs are classic indicators of infiltration, which occurs when the fore fluid leaks out of the vein into the surrounding subcutaneous tissue. Infection would typically present with redness, warmth, and possibly purulent drainage. Phlebitis involves inflammation of the vein, often causing redness, warmth, and pain along the vein's path. An air embolism is a more systemic, serious complication related to air entering the bloodstream. For example, if the fore fluid is leaking into the skin around the needle, the area might get puffy and cold. Remember that swelling and coolness at the foresite means the fluid is leaking out of the vein. Question 66. A nurse is providing discharge instructions to a client who had a cataract surgery. The nurse should instruct the client to avoid A. Wearing eyeglasses. B. Bending at the waist to pick up objects. C. Reading for extended periods. D. Sleeping on their back. Answer B. Bending at the waist to pick up objects. The question focuses on post-cataract surgery precautions. The keywords are cataract surgery and avoid. Bending at the waist, especially with a forward bend, can increase intraocular pressure, which is undesirable after cataract surgery and can risk complications. Wearing eyeglasses is generally recommended for vision correction, reading for extended periods is usually fine if comfortable, and sleeping on the back is often encouraged to protect the surgical eye. For example, you don't want to bend over too far after eye surgery because it can put pressure on your eye. Remember that avoiding bending is important to protect your eye after cataract surgery. Question 67. A client is prescribed a potassium-sparing diuretic, such as spironolactone. The nurse should instruct the client to A. Avoid foods high in potassium. B. Increase intake of sodium-rich foods. C. Report any muscle weakness or irregular heartbeat. D. Take the medication with a large glass of milk. Answer: A. Avoid foods high in potassium. The question asks for correct instructions for a client taking a potassium-sparing diuretic. The keywords are potassium-sparing diuretic and instruct the client. Potassium-sparing diuretics, like spironolactone, work by reducing the excretion of potassium by the kidneys, which can lead to hyperkalemia, high potassium levels. Therefore, clients should be advised to avoid foods that are very high in potassium, such as bananas or oranges, to prevent this potential side effect. Muscle weakness or irregular heartbeat can be signs of hyperkalemia, so reporting them is also important, but avoiding high potassium foods is a primary preventative instruction. Increasing sodium is generally discouraged in many conditions. For example, since this medicine keeps potassium in your body, you need to be careful not to eat too many potassium-rich foods. Remember that potassium sparing means it saves potassium, so you need to watch your intake of it. Question 68. A nurse is caring for a client with newly diagnosed atrial fibrillation. The nurse should anticipate that the client will most likely be prescribed which of the following medications? A. A beta blocker to control heart rate. B. A loop diuretic to reduce fluid overload. C. An anticoagulant to prevent stroke. D. A calcium channel blocker to manage blood pressure. Answer: C. An anticoagulant to prevent stroke. The question asks about the primary medication consideration for a client with new atrial fibrillation. The keywords are atrial fibrillation and most likely be prescribed. Atrial fibrillation is an irregular and often rapid heart rhythm that can cause blood to pool in the atria, increasing the risk of clot formation and subsequent stroke. Anticoagulants are crucial to reduce this risk. While beta blockers and calcium channel blockers may be used to control heart rate, and diuretics for fluid management, anticoagulation is the most critical intervention for preventing stroke in atrial fibrillation. For example, because atrial fibrillation can cause blood clots that lead to strokes, you'll usually be given medicine to thin your blood. Remember that preventing strokes is a major goal when you have atrial fibrillation. Question 69. A client is receiving a continuous infusion of vancomycin. The nurse should monitor for which of the following adverse effects, especially if the infusion is administered too rapidly? A. Red man syndrome. B. Stevens-Johnson syndrome. C. Nephrotoxicity. D. Hepatotoxicity. Answer: A. Red man syndrome. The question focuses on a specific adverse effect associated with vancomycin infusion. The keywords are vancomycin and adverse effects, especially if administered too rapidly. Red man syndrome, characterized by flushing, erythema, and pruritus, itching, particularly on the face and neck, is a histamine-mediated reaction that can occur if vancomycin is infused too quickly. While vancomycin can cause nephrotoxicity, kidney damage, and ototoxicity, hearing damage, red man syndrome is directly related to the rate of infusion. Stevens-Johnson syndrome is a severe dermatological reaction, much less common. For example, if vancomycin is given too fast, your skin might turn red and itchy. A helpful tip is to remember that red man syndrome is a sign that vancomycin is being given too quickly. Question 70. A nurse is assessing a client with cirrhosis of the liver. The nurse should assess for which of the following signs of hepatic encephalopathy? A. Jaundice and ascites. B. Asterixis and confusion. C. Esophageal varices and hematemesis. D. Splenomegaly and thrombocytopenia. Answer B. Asterixis and confusion. The question asks about signs of hepatic encephalopathy, a complication of liver disease. The keywords are cirrhosis and hepatic encephalopathy. Hepatic encephalopathy occurs when the liver fails to adequately detoxify the blood, leading to the accumulation of ammonia and other toxins in the brain. This can manifest as neurological symptoms, including asterixis, a flapping tremor of the hands, and confusion or altered mental status. Jaundice, ascites, esophageal varices, hematemesis, splenomegaly, and thrombocytopenia are all signs of cirrhosis itself or its complications, but asterixis and confusion are specific indicators of the brain dysfunction associated with hepatic encephalopathy. For example, if your liver isn't working well, your brain can be affected, causing you to shake your hands uncontrollably and become confused. Remember that shaking hands and confusion are key signs that your brain is being affected by liver problems. Question 71. A client is prescribed atorvastatin, a statin medication. The nurse should instruct the client to report which of the following adverse effects? A. Decreased blood pressure. B. Muscle pain or weakness. C. Increased appetite. D. Dry mouth. Answer B. Muscle pain or weakness. The question focuses on a critical adverse effect of statin medications. The keywords are atorvastatin and adverse effects. Muscle pain, aching, or weakness, myopathy, and in rare cases, rhabdomyolysis, severe muscle breakdown, are significant potential side effects of statins. Patients should be instructed to report these symptoms promptly, as they may indicate a serious reaction. Decreased blood pressure is not a typical side effect, and increased appetite or dry mouth are also not commonly associated with statins. For example, if you start getting sore muscles after taking cholesterol medicine, you need to tell your doctor. Remember that muscle aches are a major warning sign when you're on statins. Question 72. A nurse is preparing to administer a client's pain medication. The client states, "I don't feel like I need it right now, but I'll take it because it's scheduled." The nurse's best response is to A. Administer the medication as scheduled, as it is prescribed for regular intervals. B. Document the client's statement and delay administration until the client requests it. C. Explain that the medication is more effective when taken consistently to prevent pain. D. Ask the client if they are experiencing any side effects from the medication. Answer C. Explain that the medication is more effective when taken consistently to prevent pain. The question asks for the best response when a client is hesitant to take scheduled pain medication. The keywords are pain medication and don't feel like I need it right now, but I'll take it because it's scheduled. For pain medications prescribed on a schedule, the intent is often to maintain a consistent level of pain relief and prevent pain from escalating. Explaining the rationale behind scheduled dosing helps the client understand the importance of adherence, even if they don't currently perceive severe pain. Administering without addressing the client's concern, delaying without assessment, or focusing on side effects are less appropriate responses. For example, Your doctor wants you to take this medicine regularly to keep your pain away before it even starts. Remember that scheduled pain medicine is given to prevent pain from coming back. Question 73. A client is recovering from a stroke and has difficulty swallowing. The nurse should prioritize which intervention to prevent aspiration? A. Offering the client liquids with a straw. B. Administering medications in crushed form. C. Thickening liquids and pureeing solid foods. D. Encouraging the client to eat quickly. Answer: C. Thickening liquids and pureeing solid foods. The question focuses on preventing aspiration in a client with dysphagia, difficulty swallowing, after a stroke. The keywords are stroke and prevent aspiration. Thickening liquids and pureeing solid foods modifies the consistency of food and fluids to make them easier and safer to swallow, thereby reducing the risk of aspiration, food or liquid entering the lungs. Offering liquids with a straw can sometimes increase the risk of aspiration by encouraging faster swallowing. Administering medications in crushed form might be necessary, but the consistency of all intake is the primary concern. Eating quickly can also increase aspiration risk. For example, making liquids thicker and food mushy helps make it safer to swallow after a stroke. Remember that changing the texture of food and drinks is key to preventing choking when you have trouble swallowing. Question 74. A nurse is assessing a client who is postoperative day 1 after a knee arthroscopy. Which of the following findings requires immediate nursing intervention? A. Mild swelling around the knee. B. Pain rated as 4 out of 10 that is relieved by medication. C. Inability to bear weight on the affected leg. D. Absent pedal pulse in the affected foot. Answer: D. Absent pedal pulse in the affected foot. The question asks for an immediate nursing intervention trigger after knee arthroscopy. The keywords are knee arthroscopy and immediate nursing intervention. An absent pedal pulse signifies a lack of circulation to the foot, which is a critical surgical complication that requires immediate assessment and intervention to prevent tissue damage or limb loss. Mild swelling and pain relieved by medication are expected. Inability to bear weight is also common after knee surgery. For example, if you can't feel a pulse in someone's foot after leg surgery, it's a medical emergency. Remember that no pulse in the foot is a sign of a circulation problem that needs immediate attention. Question 75. A client is prescribed a beta blocker, such as metoprolol, for hypertension. The nurse should instruct the client to report which of the following adverse effects? A. Increased heart rate. B. Constipation. C. Dizziness upon standing. D. Shortness of breath. Answer: D. Shortness of breath. The question focuses on important adverse effects of beta blockers. The keywords are beta blocker and adverse effects. Beta blockers can sometimes cause bronchoconstriction, especially in individuals with underlying respiratory conditions like asthma or COPD. Therefore, shortness of breath is a significant adverse effect that should be reported. While dizziness upon standing, orthostatic hypotension, can occur with antihypertensives, it's less specific to beta blockers than bronchoconstriction. An increased heart rate is the opposite of what beta blockers do, and constipation is not a common side effect. For example, if you start having trouble breathing after taking your blood pressure medicine, it could be a sign that it's affecting your lungs. Remember that feeling short of breath is a serious side effect that needs to be reported when taking beta blockers.